September is AFib Awareness Month. If you didn't know, atrial fibrillation is an abnormal heartbeat condition. Experts say now that people are living longer, it's becoming even more common. This morning, we welcome Dr. Mahabib Jamil. He is a cardiothoracic surgeon with Dignity Health. Dr. Jamil, good morning. Thanks so much for being here.
Hey, good morning, Brandy. How are you?
I'm well. Explain for people who don't know, what causes AFib?
So AFib, we don't exactly know what causes AFib, but we know the risk factors. As you age, and you have some risk factors like diabetes, high blood pressure, or smoking. Alcohol consumption and excessive caffeine can cause it sometimes. And just overall, being in a stressful environment of the Western world, and the chambers of the heart have an electrical system that sometimes go aberrant, and that causes the assistant chamber of the main pumping chamber of the heart to go into this abnormal rhythm called the fibrillation. And that fibrillation sometimes can, cause an abnormal heart rate, or more importantly, it because the heart is fibrillating, sometimes blood can get stagnant in the heart and cause a blood clot, which subsequently can shoot up to your brain and cause you a stroke. So that's the nature of AFib.
What are some of the most common symptoms that people would feel or that their family members should note?
Well, family members, it'd be hard for family members to note exactly, but, patients would feel palpitations sometimes. And when the heart function isn't great, they don't feel great overall. They'll feel short of breath. Sometimes they'll cause chest pain too. On the other end, sometimes patients get conditions like coronary artery disease or aortic stenosis or any other heart condition, or they're admitted to the hospital for some other condition, and the physicians pick it up on monitoring.
And one of the other ways that it can be monitored too is through a smartwatch. Tell us more about that.
Right. So if you know that you have AFib, it's a good way to keep a track on whether your heart is in normal sinus rhythm or in AFib. So, your Apple phone will tell you, or Apple Watch will tell you, like, put your finger here and then monitor for that many seconds, and then you have a reading whether it's normal sinus or AFib.
And talk more about treatment options. What are they?
Lots of treatment options. So first we start with medications, and that's the majority of patients will start with medications. And so once your medications are not controlling your symptoms enough, or is not able to put your heart back into a normal sinus rhythm, then you have catheter ablations where they go through the groin or the wrist, and then they will, cause some electrical fences inside the heart. If that doesn't work, and there are pretty aggressive options like surgery as well, especially on patients who are getting operations for other reasons. So we're going into the chest for some reason and they have AFib. There are pretty aggressive treatments that we can do that are very successful for AFib.
So we've talked about the treatments, we talked about the things that perhaps can cause this. Are there preventative measures that people can take to avoid getting it?
Oh, for sure. Just like maintaining a healthy lifestyle, just less stress, which is hard to do. And then, managing your diabetes, managing your blood pressure, keeping in touch with your primary care physician, getting rid of unhealthy habits like alcohol and smoking. But generally, it's somewhat like diabetes. Sometimes you get it and it kind of stays with you for life, then you have to control it. So overall healthy lifestyle is the goal here.
That's absolutely right. Of course, we always hear doctors tell us less stress. So that may be the the remedy for a lot of things.
Doctors are the most stressed of themselves.
Yes. Yes. Doctor, we appreciate you joining us this morning. Thanks so much.
Sure. Absolutely, Brandy. Thank you so much.